Ibuprofen, Naproxen, and Diclofenac. 6 silent side effects. Your doctor dismissed as just aging. You reach for it without even thinking twice. A headache, a sore knee, a bad night's sleep on your back, and you pop an ibuprofen, a naproxen, or a diclofenac tablet like it's candy. Because that's exactly how these drugs have been marketed for decades. Safe, simple, over-the-counter, no big deal. They sit in nearly every medicine cabinet in America, in purses, in glove compartments, in desk drawers at work, taken so casually that most people never even glance at the warning label folded up inside the box. But what if the tiredness you've been blaming on getting older, the swelling in your ankles, you've been blaming on sitting too much, or the ringing in your ears you've been blaming on just one of those things, wasn't aging at all? What if it was the pill you've been taking almost every single day without a second thought? These medications belong to a class called NSAIDs, non-steroidal anti-inflammatory drugs, and while they're genuinely effective at reducing pain and inflammation, they come with a growing list of side effects that build up slowly, quietly, and get blamed on almost anything except the actual cause. Today we're counting down 6 of them, starting with the one most people notice first but never connect to the pill in their medicine cabinet, all the way to the one the FDA itself considers serious enough to put directly on the warning label. Let's start at number 6. Number 6. Fluid retention and swelling. If you've noticed your ankles puffing up by the end of the day, your rings feeling tighter than they used to, or a few extra pounds on the scale that seem to appear out of nowhere and won't budge no matter what you eat, it's easy to blame it on salty food, hot weather, or simply getting older. But NSAIDs like ibuprofen, naproxen, and diclofenac interfere directly with prostaglandins, hormone-like compounds that normally help your kidneys regulate sodium and fluid balance throughout the day, adjusting constantly based on what you eat, how much water you drink, and how active you've been. When that regulation gets disrupted, your body starts holding on to sodium and water it would otherwise release, and that extra fluid has to go somewhere, usually your lower legs, ankles, and feet, the parts of your body where gravity naturally pulls excess fluid throughout a long day on your feet. For most healthy adults taking these drugs occasionally, this swelling is mild and temporary. But for anyone with existing heart or kidney concerns, or anyone taking NSAIDs regularly over weeks or months, that fluid retention can quietly strain the cardiovascular system, sometimes contributing to worsening heart failure symptoms that get mistaken for ordinary aging fatigue. Some people even notice a strange pattern without ever connecting the dots, feeling more short of breath climbing stairs, or waking up puffier on days, right after taking these medications for a flare-up of back or joint pain. It's subtle, it's easy to dismiss, and it's almost never the first thing anyone thinks to blame. But swelling is far from the strangest symptom on this list, because number 5 involves something you'd never expect a pain reliever to touch at all: your blood pressure reading, the exact number your doctor checks at the start of every single appointment. Number 5. Rising blood pressure. This one catches even health-conscious people off guard, because most of us associate blood pressure with diet, stress, or genetics, never with the pill we took for a headache last Tuesday. But here's the connection almost nobody talks about. The same prostaglandin disruption responsible for fluid retention also affects the blood vessels themselves, causing them to constrict slightly and reducing the kidney's ability to flush out excess sodium efficiently. 2 separate mechanisms working together in the background, quietly reinforcing one another every single time the medication is taken. The combined effect, more fluid in the bloodstream plus tighter blood vessels, can push blood pressure upward, sometimes by a small but meaningful margin, especially with regular or long-term use. For people already managing hypertension, this becomes even more significant, because NSAIDs can actually blunt the effectiveness of common blood pressure medications, including ACE inhibitors, ARBs, and diuretics, essentially working against the very treatment meant to protect your heart. Many people never make this connection because their blood pressure readings creep up gradually over months, right alongside a slow increase in NSAID use for chronic pain, and both patient and doctor simply chalk it up to blood pressure naturally rising with age. It's rarely that simple. Some studies have found that regular NSAID use can raise average blood pressure by a small but clinically meaningful amount, enough over years to shift someone from a normal reading into a range doctors classify as elevated or hypertensive, all without a single new symptom to point the finger at the actual cause. But if rising blood pressure feels concerning, wait until you hear what's happening quietly inside your inner ear at number 4. Number 4. Tinnitus and hearing changes. A persistent ringing, buzzing, or humming in your ears that seems to come from nowhere is one of the most commonly overlooked inside side effects, largely because almost nobody thinks to connect their ears to their pain medication. But research, including data from large long-term health studies, has linked frequent NSAID use to an increased risk of tinnitus, and in some cases, subtle changes in hearing sensitivity over time, changes that often arrive so gradually that the person experiencing them barely notices until a spouse or family member points it out. The suspected mechanism involves reduced blood flow to the tiny, delicate structures inside the inner ear, structures that are especially sensitive to the same prostaglandin pathways these drugs interfere with elsewhere in the body. For older adults, this is particularly easy to miss, because gradual hearing changes are so often written off as an unavoidable part of aging, something you just learn to live with rather than something worth mentioning to a doctor. The catch is that this side effect tends to be dose-dependent and cumulative, meaning the risk climbs the more frequently and the longer these medications are used, which makes it especially relevant for anyone managing chronic pain with daily NSAID use, rather than occasional, short-term relief. In some cases, the ringing fades once the medication is stopped, which is itself a telling clue that's rarely put together in time. If your ears have been ringing lately, that alone might be worth a conversation with your doctor. But what's happening at number 3 is even harder to detect, because unlike ringing ears, this one often produces no warning sign at all. Number 3. Silent gastrointestinal damage. Most people assume that if an NSAID were hurting their stomach, they'd feel it. Sharp pain, obvious discomfort, something unmistakable enough that they'd stop taking the medication immediately and call a doctor. But that assumption is dangerously incomplete. NSAIDs work in part by blocking an enzyme called COX-1, which your stomach lining relies on to produce a protective layer of mucus that shields it from its own digestive acid, a mucus barrier that's constantly being rebuilt throughout the day just to keep the stomach from digesting itself. Without that protection, the stomach lining becomes vulnerable to irritation, erosion, and in more serious cases, ulcers. And here's the unsettling part. A significant number of these ulcers cause no pain whatsoever, especially in older adults, whose pain signaling can become less reliable with age. The first sign some people ever get isn't discomfort at all. It's unexplained fatigue from slow, chronic blood loss, or in more severe cases, a sudden, alarming gastrointestinal bleed that seems to appear out of nowhere. This risk climbs substantially with regular use, higher doses, and age over 60, and it's one of the primary reasons doctors generally recommend using the lowest effective dose for the shortest possible time. What makes this side effect especially deceptive is that someone can take these medications for years without a single stomachache, only to discover during a routine blood test that their iron levels are unexpectedly low, a quiet clue that slow bleeding has been happening in the background the entire time, invisible on the outside, but measurable the moment someone finally thinks to look. Silent damage happening beneath the surface is unsettling enough on its own. But what's happening to an organ you can't feel at all? An organ with no pain receptors to warn you when something's going wrong. At number 2, might be the most overlooked risk on this entire list. Number 2. Declining kidney function. Your kidneys rely heavily on healthy blood flow to filter waste from your bloodstream continuously, quietly processing gallons of blood every single day without you ever having to think about it. And prostaglandins play a direct role in keeping that blood flow steady, especially during moments of stress on the body, like dehydration, illness, or intense physical activity. NSAIDs interfere with that exact mechanism, and for kidneys that are already working under pressure, whether from age, dehydration, or an existing condition, that interference can meaningfully reduce filtering capacity over time. Doctors sometimes refer to a particularly dangerous combination as the triple whammy, an NSAID combined with a diuretic and a blood pressure medication like an ACE inhibitor or ARB, a combination that can significantly increase the risk of sudden, acute kidney injury, sometimes within just days, and one that's alarmingly common among older adults, managing multiple chronic conditions at once, with multiple prescriptions from multiple providers who may not always be looking at the full picture together. Because early kidney decline rarely causes noticeable symptoms, mild fatigue, slightly reduced appetite, occasional puffiness, it's remarkably easy for both patients and doctors to attribute it to ordinary aging rather than to a daily pain reliever sitting quietly in the medicine cabinet. Chronic, long-term NSAID use has also been associated with a slower, more gradual form of kidney damage, sometimes called analgesic nephropathy, which can develop silently over years with no obvious symptoms until kidney function has already declined substantially, often discovered only after a routine checkup flags abnormal lab results that no one saw coming. Blood tests that measure kidney function are one of the only reliable ways to catch this early, which is exactly why doctors often recommend periodic monitoring for anyone using NSAIDs regularly over the long term, especially older adults or those already managing high blood pressure or diabetes. And that brings us to the most serious entry on this entire list, the one that carries the strongest official warning of them all, the one hiding in plain sight on a label most people have never actually read. Number 1. Increased risk of heart attack and stroke. This is the side effect that pushed the FDA to strengthen its boxed warning label, the most serious warning a medication can carry, reserved for risks considered significant enough that every prescriber and pharmacist needs to see it immediately, and it applies to nearly all NSAIDs, including Ibuprofen, Naproxen, and Diclofenac. Research has shown that the risk of a serious cardiovascular event can increase within just weeks of starting an NSAID, and that risk appears to climb further with higher doses and longer duration of use, a timeline far shorter than most people would ever assume for a drug they consider mild enough to keep in their pocket. Some research suggests diclofenac in particular may carry a comparatively higher cardiovascular risk among commonly used NSAIDs, a finding significant enough that several countries have restricted its over-the-counter availability entirely. A regulatory response that speaks volumes about how seriously this particular risk is taken outside the United States, even when the drug is still readily available on domestic pharmacy shelves. The proposed mechanism involves the same prostaglandin disruption behind several other items on this list, this time affecting blood vessel constriction, platelet behavior, and blood pressure simultaneously, creating conditions that can make clot formation more likely in vulnerable individuals. A chain reaction that plays out invisibly, with no outward symptom, until the moment it matters most. What makes this particularly unsettling is that the increased risk isn't limited to people with obvious heart disease. It has been observed even in people with no prior cardiovascular history, particularly with higher doses or longer use. The warning applies from the very first days of use, not just after months or years, which runs directly against the common assumption that occasional, short-term use of an over-the-counter pain reliever couldn't possibly carry any real cardiovascular weight. A chest twinge, unusual shortness of breath, or sudden fatigue in someone regularly taking these medications is far too often written off as stress or aging, when it may in fact be the single most serious warning sign on this entire list. So there you have it, 6 side effects hiding in plain sight behind 3 of the most common medications in American medicine cabinets: swelling, rising blood pressure, tinnitus, silent gastrointestinal damage, declining kidney function, and the most serious of all, increased cardiovascular risk. None of this means these medications are dangerous for everyone, or that you should panic and stop taking them today. Used occasionally, at the lowest effective dose, for the shortest amount of time necessary, NSAIDs remain a genuinely useful tool for millions of people, managing everything from headaches to arthritis to sports injuries. But if you've been taking ibuprofen, naproxen, or diclofenac regularly for weeks, months, or years, and you've been quietly blaming symptoms like these on getting older, it may be worth a real conversation with your doctor about what's actually going on beneath the surface, and whether an alternative pain management approach might serve you better long-term. Never stop or change a medication without medical guidance first, and never assume that because a drug is sold over the counter, it comes without real risk when used regularly over time. If this opened your eyes, hit like, subscribe for more science-backed health content, and tell us in the comments which one of these 6 surprised you the most, and whether you'll be having that conversation with your doctor sooner rather than later. Sometimes the most important health decisions start with nothing more than finally asking the right question about something that's been sitting in the medicine cabinet the entire time.